Recreational therapy for schools. What is recreational therapy? Recreational therapy is a profession that began as a demand from patients. The profession involves activity-based methods that can help an individual with injury, illness, or disability. Recreational therapy can be one-on-one or group counseling. Recreational therapy will improve well-being and functioning in physical, social, emotional, cognitive, and even spiritual. Recreational therapy should be accessible to all children in every school. Why should children have access to recreational therapy? The third leading cause of death for children in 2021 was reported to be suicide. The second reported leading cause was assault, such as gun violence. According to a study by the University of Michigan, as many as 1 in 7 children in the United States are currently suffering from an undiagnosed treatable mental health disorder. A study of a national sample of American children found that over the past year, 60% of children were exposed to violence, crime, or abuse in their homes, schools, and communities. Why is recreational therapy not always accessible to children? Recreational therapy can be too expensive and unaffordable. Insurance may not cover the service. The service may not be accessible in the area. Parent may not know that this service is available. Mental health may not be noticed. Parents do not know where this service may be offered. Parents may not recognize the health issue or assume it will just go away. Shame and stigma towards help or disorders. Where can a child experience trauma? Society can expose children to issues such as inequalities, discrimination, racism, popular culture, government policies, and more. A child's environment can expose them to risk in their neighborhood, access to green space, proper nutrition, housing, pollution, natural disasters, and climate change. A child's community can have lack of healthy relationships. A child may not have access to a healthy relationship with peers, teachers, or mentors. They can experience pressure, bullying, lack of communication. In a family setting, a child can experience abuse by a loved one, financial instability, be exposed to mental health problems within their family, experience domestic violence. A child can also have a traumatic experience due to gender, ethnicity, sexual orientation, disability, reliefs, coping skills, and more. What happens if a child does not receive treatment? A child with ADHD can be at risk of engaging in drinking, smoking, doing drugs, risky sexual choices. An adulthood with ADHD can have trouble with getting to work on time, completing work by set deadlines, staying organized, getting along with coworkers, accepting criticism calmly, ultimately not have job security. Adults also have a heightened risk of experiencing car accidents, gambling, and trouble with the law. Common diagnoses in children. Some common diagnoses in children are developmental disorders and behavioral disorders. 6 in 10 children are diagnosed with moderate to severe attention deficit, hyperactivity disorder. In the year 2022, 7 million children aged 3 to 17 were diagnosed with ADHD. 7 million children is almost half of the population as presented in the pie chart below. Symptoms of ADHD are difficulty focusing and staying on task, difficulty sitting still and fidgety, impulsive, easily distracted, disorganized, and more. About 1 in 6 children aged 3 to 17 years were diagnosed with a developmental disability during a study period of 2009 to 2017. These included autism spectrum disorder, attention deficit, hyperactivity disorder, blindness, and cerebral palsy, among others. Anxiety, depression, and behavior disorders are the most commonly diagnosed mental disorders in children. Based on U.S. data, nearly 1 in 5 children ages 3 to 17 have been diagnosed with a mental, emotional, or behavioral health condition in the year 2021. Benefits of recreational therapy in schools. There are a variety of ways recreational therapy can benefit schools. The physical benefits of recreational therapy can be restoring mobility, increasing mobility, improving strength and endurance, enhancing flexibility, improving strength and coordination. The mental benefits of recreational therapy can be helping people manage stress, recover motor abilities, boost confidence, supports socialization, enhances reasoning abilities. The image to the left depicts a few techniques that can help manage stress. Most of these activities can be used as a recreational therapy tool. Activities that help and how. Art, music, and exercise are all useful tools in recreational therapy. Through art, individuals can paint, draw, sculpt, and more. A participant does not need to be an artist to participate, just engage and enjoy themselves in the activity.
Some benefits of art encourage emotional expression and processing, reduce stress and promotes relaxation, improves self-esteem and identity development, helps with trauma recovery and grief.